Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet. I am Bob. I'm exactly one half of the Bob and Brad team, and today my guest host is
Mike Keenetz, physical therapist assistant.
And Mike is going to help me interview Rick Olderman, and we're going to talk about back pain, knee and hip pain, shoulder pain, and foot and ankle pain. So stick around.
Because you're going to realize everything's connected.
Right.
So the first book we'd like to talk about is Fixing You Back Pain. So you kind of talked about it a little bit in the first one, but who would benefit from this book?
Anyone with chronic back pain or sciatic pain or SI joint pain, anything like that. Yeah. Because, again, if you're having chronic pain, it's because the component thinking that has been applied to your pain has not worked. And you need a systemic solution, something about your whole body rather than just the back or just the pelvis.
Makes sense.
So in the book, you have a large section discussing side bending problems. Can you describe what is happening during that and what problems occur?
Yeah, I have my trusty skeleton here, so I'll show you.
Great.
Okay.
Sure. Awesome.
And this is one of my secret weapons that I used in my clinic, because if I could get patients to understand what was going on, then they could buy into what I was showing them. So, which is so important, as you know, Bob and Mike.
Right.
All right, so side bending problem. Here we're looking at the back of the spine, and for those of you who are just listening, if you just imagine looking at a body from behind, all right. So one side of the pelvis is higher, all right, than the other in a side bending problem. And usually the same side of the rib cage is lower on that side. So if you're imagining this, imagine a lot of compression happening on this one side where the pelvis is higher and the rib cage is lower. This is basically a side bending problem, all right? And this causes lots of unilateral problems, such as, for instance, left back pain, or left sciatic pain, or left SI joint pain, or left facet joint pain, or left QL tightness, or all things like that. Any left versus a right side, it would be a side bending problem. Now, in medicine, what we're taught in neutral spine mechanics, if we have side bending, we have rotation to the opposite direction, right? Mm-hmm. And what I found, and this is what Dr. Sarman focuses on, is solving the rotation. But that would work temporarily, and if you look at a lot of our courses, identify, oh, you've got a rotated vertebra. But you have to ask yourself, why is that rotation happening? The driver of the rotation in the spine and the pelvis is from the side bending. Once I fix the side bending, all the rotation melts away.
Goes away. Very good. What are some of the common initial causes of this?
Okay, so this is a great question. So this goes into the hand smacks. This is a withdrawal reflex pattern. Usually we're getting away from pain somewhere in this leg of the side where the pelvis is higher. There's a problem in this lower extremity somewhere. All right? It could be an old problem. It could be a new problem. But your body has adapted. Just like if you're stepping on a sharp tack, you try and get that foot off of that. Well, to get your foot off of that, you contract those waist muscles, and it pulls your pelvis up, and then your rib cage goes down, right?
Sure.
That's that withdrawal reflex pattern. So what you're doing is you're withdrawing from some problem here. So I can easily correct the pelvis and rib cage. I can do it in 10 seconds, all right? But it's going to keep coming back if we don't solve the reason that is happening. And so that is what this whole system is about, is solving the whys behind all of these things happening. If you solve the why, it will never come back again. And so that's what I've been doing these last 25 years, is figuring out, well, what is causing this pattern to occur? And I've been teasing all of this out, both from a movement standpoint and from a habits standpoint.
How common is this in your practice?
I'll tell you, every single person.
Really?
All right. Anyone with unilateral back pain, sciatic pain, and I'll tell you what. you're still practicing, right, Bob and Mike? Are you both still practicing?
No, I'm not.
We're video making.
Mike, you're video making. Okay. Next time you see anyone with foot, knee, hip, pelvic pain, unilateral back pain, SI joint pain, just get down on your knees from behind and measure the height of the pelvis. And you will find that often the side that is they're having pain on, that pelvis is higher.
Will be higher.
Because the body has to try to get off of that pain.
Sure.
And it does it by hiking everything up, all right? Which creates the side bending pattern. So if you have an old high school injury of an old sprained ankle, or you had surgery on your knee and it was rehabbed okay, but you were young and you just wanted to get out of there and it wasn't completely corrected, and it didn't go into correcting gait patterns and all this kind of stuff, well then your body remembers these things. And slowly your body adapts by slowly hiking that pelvis up until the point where that straw breaks the camel's back. And now, okay, I've been hiking this up enough, and now we're going to create some back pain and sciatic pain, or SI joint pain, or whatever for you. And that's how it really happens.
Yeah, makes sense.
So with the rib cage being pulled down, like you were showing, and the pelvis being pulled
up.
up, this can result in compressive forces in the back. So what is the problem with that? Like, why is it causing back pain, and how does it present to people if they're not sure?
Yeah, well, I'll tell you what. Unfortunately, we can't share screens because I have pictures of people with side bending problems.
Sure.
So the easiest way to do this is just get someone to take a picture of your back with your shirt off. All right? And what you'll see is you'll see a bigger crease on one side of the back versus the other. And that is your signal that you have a side bending problem. All right? Now, you can have a side bending problem without the crease, but if you have a crease that's bigger on one side than the other, it means that it's been around a longer time.
Gotcha.
Right? If you just developed the side bending problem, well then you probably will not have developed the crease yet. All right? So that's a really easy way to know whether you have a side bending problem without anyone testing you or anything like that. And chances are that side bending problem, I'd say in 80 to 90% of the patients, the side bending problem is occurring on the same side as some pain that you're having currently, or
Right.
some old injury that you haven't addressed yet. Now, you can just look at this skeleton and you can see if I'm doing something like this, all of the vertebra then become compressed on that side.
Right.
Right? So everything becomes squished. It squishes the nerve roots that exit the spine, that travel into and create the sciatic nerve. It causes all sorts of havoc in the facet joints, the discs between the vertebrae, all sorts of things. And so you can just look at that and intuitively understand that, oh, gosh, if I didn't compress this side of my spine, I bet you that would solve a lot of my pain. Lo and behold, it does. It's that easy. It's so easy to solve this. But everyone keeps looking at it as a rotation problem
Sure.
instead of a side bending problem. Or they're not even looking at this alignment issue at all.
Right.
Most practitioners, because I train, all the new therapists that come into my clinic, they have to learn my method. And so, older therapists aren't interested in learning something new like this, but the younger ones are hungry for it, especially if they've been out for a year
Absolutely.
or two, because they know that what they've been taught isn't really working in the clinic. And so I train them, and they get it. And almost all of them, no one's ever talked to them about this pattern of issues going on
It was
before.
new to me.
So, yeah. So anyway, it's a big deal and very common.
So what are some of the exercises you prescribe to your patients that have this issue?
Okay. Well, so that's a good question, and to solve this, I'll tell you what. You can solve this in about 10 footsteps. If you just lift up this arm and walk, you will find that after you're done with about 10 steps, this all will be corrected.
Sure.
All right? But it will come back. It will come back because the exercises that will solve this have to do with what is at the root cause of this in the first place.
Gotcha.
Is it an ankle issue? Is it a knee issue? Is it a hip issue? That's what we need to solve. So often in my clinic, people come in with sciatic pain or back pain, and they have MRIs that show disc herniations or whatever, and it's their hip. It's their hip. When we solve the hip joint, all their back pain goes away, because now they don't have the side bending problem occurring because of the painful hip anymore, or the dysfunction in the knee, or the dysfunction in the foot. So that's how I wish I could give a simple answer as to which exercise will solve this. The arm up and while you're walking will temporarily solve it.
Sure.
But if you want a permanent solve, you have to solve the reason it's happening in the first place, which is what all my books are about, is solving the reasons these things are happening, not just solving the thing itself.
Yep.